Local health experts are helping Kansas Cityans prepare for the worst. They're training people on what to do in case of a mass shooting as part of their Stop the Bleed program. Jason Martin is a registered nurse and a paramedic. We want to thank you for joining us today.
Thanks for having me.
You'd be one of the first responders to get the call. God forbid it happens here. That's why this Stop the Bleed program has become such a thing.
Absolutely. You know, the program originated in 2015, and it was just because of what we're talking about. It can happen anywhere. It can happen on a safe softball diamond. It can happen at a mall, at a sporting
concert,
event.
at a
and
church.
We have to be ready 24/7. And we found out that the bystander is the first person, the person sitting next to you, they want to help, but they want to know what to do. And that's what this program was designed to do.
So it may not be the paramedic that arrives. It may be just your buddy next to you or a stranger next to you.
That's the person that's going to be in that impactful 3 to 5 minutes that can make that life-saving decision on stopping the bleed that can make the biggest difference.
So what do you do? How do you stop the bleed? How do you teach people this?
Absolutely. This program is designed around very basic concepts. And the first one is recognizing uncontrolled bleeding. So the American College of Surgeons have said if you have an injury to an artery, you could have less than 3 minutes before a life is lost. So the number one thing is direct pressure, getting people to be very aggressive, putting direct pressure on. That is going to control the majority of bleeding that you're ever going to encounter. But if it is not enough, and we teach these signs and symptoms where, you know what, the direct pressure isn't enough, let's go ahead and use a tourniquet. And we show people how to safely use a tourniquet and feel comfortable using a tourniquet.
Right, right. And pack it as well?
Absolutely.
Is that part of your teaching, right?
Absolutely. If it's something that you're not really sure where the bleeding's coming from, but you see a hole like in a gunshot victim and it's open, to go ahead and shove something in there, whether it's a piece of cloth. We want it to be as clean as possible.
Sure.
But use anything that you possibly can to stop that bleeding by shoving something in there, putting direct pressure, and then lastly using a tourniquet if you need to.
Hate to even talk about it, but I know as HCA Midwest Health, a big health conglomerate here in the Kansas City area for sure, are you ready for such a thing if it would happen here?
You know,
are you preparing?
I think we do everything that we possibly can, and we practice and do different drills throughout the years, and we think of every possible scenario from derailed trains to mass shootings to, you know, a 10-car pileup. And we are fortunate to have 7 facilities, 4 of which are trauma centers. But we also rely on our state, local resources, our other facilities in the area to make sure our patients have the best outcomes.
Yeah, let's hope we never have to talk about it.
I hope not.
Jason, thank you
so much for having me.
Stop the Bleed, very important program. For more information from HCA Midwest Health, and the general public can take these classes, right? Go to the KCTV5 mobile app, click Found It on 5.